Hi, my name is Dr. Karim Dhanani. I'm a naturopathic physician from Toronto, Canada. I've been in practice for over 20 years. Most of my practice has been from Toronto. I decided to focus on chronic disease, and I've been doing this with the most amount of attention to detail as possible. I pride myself on trying to know everything about the human body, both physically, both mentally, and then again, emotionally. I decided to do most of my training, not just in North America, but also in Europe. So I find myself traveling at least once, sometimes twice a year to Germany from Toronto to learn this concept or this conceptual framework known as biological medicine. So I've been on a search to try to find the best ways of assessing and influencing the environment. And this comes and often relates to the autonomic nervous system. So I've traveled to try to determine how to assess and how to treat the autonomic nervous system. There's a variety of different techniques and technologies that are out there. And I found myself last year in Baden-Baden at Biological Medicine Week, of where I've been attending every year for almost 20 years. And I found a company called Nesa. And I found it extremely interesting how they are treating the autonomic nervous system by using what I would call terrain medicine, using very low, very weak microcurrents. So they act as a stimulatory process and not an inhibitory process. They work at trying to balance the autonomic nervous system. We've often focused on what I would consider the top-down approach. That is, vagus nerve moving downward. We talk about gargling, humming, singing, gagging, all of these things that try to have an impact on this vagus nerve moving downward. And it might come as some surprise, but that is only 20% of the overall component of the vagus nerve. 80% is actually from the bottom up. So if we try to only focus on the top down, we're only getting basically 20% of the impact. The rest of it is 80% from the bottom up. So then I'm looking around at all these different tools and I'm trying to find something that is, from an extremity perspective, working its way back up. And that's where Nesa steps in. It focuses on the extremities and providing a weak electrical current in the language that speaks to the electrons to the cells. We're going from the extremities back upwards through all these different branching points back into where the body receives the information and then takes it back to the vagus nerve. So that gives us the feedback mechanism, which I find extremely cool because we're not just trying to have an impact directly from the top down to the vagus nerve, but also from the bottom up, which is an extremely unique mechanism. Never before have I seen something like this. We've tried to be very precise in our treatment mechanisms by looking at the top-down approach, but the bottom-up approach makes so much more sense and gives us a much, much, much better opportunity to help to balance the autonomic nervous system.